All right, let's dive into the world of veterinary neurology. Today we're looking at a case study from the Life Journal about a 3-month-old Bichon Frise puppy with seizures.
Oh, seizures in a puppy. What makes this case so interesting?
Well, it's not just about the seizures. It's about the connection between the liver and the brain. We're talking about something called hepatic encephalopathy, or HE for short.
Ah, HEE. So you're saying the liver's not functioning properly, and that's impacting the brain. And the cause in this case, a portosystemic shunt. It's an abnormal blood vessel, a connection that lets toxins bypass the liver, and they end up reaching the brain.
Exactly. This puppy was struggling, I imagine. The report mentions seizures, especially after meals, which makes sense if you think about it, all those toxins flooding in after eating.
Yeah, and there were other neurological issues too, like abnormal eye movements and even a rigid posture. It mimics something called decerebellate rigidity.
Wow, so how did they even figure out what was going on with this puppy?
Yeah. Well, the first clue was the blood work. Elevated liver enzymes, to be specific. AST, ALP, and GGT, all indicating a liver problem.
So the blood work was a red flag, but they needed more information. What did they do next?
They did an abdominal ultrasound, and that's how they saw the portosystemic shunt, confirming what the blood work already suggested. But they took it a step further and did a CT scan, which gave them an even more detailed look, not only confirming the shunt, but also revealing lesions in the puppy's brain.
Lesions in the brain. That's really concerning.
It is. It really highlights how serious the situation was, and it further solidified the diagnosis of HE. Those toxins were really impacting the brain structure.
And this is where things get really interesting. They use electroencephalography, or EEG, to analyze the puppy's brain activity.
EEG is a fantastic tool. It allows us to see the brain's electrical activity in real time. They wanted to see if there were any unusual patterns that might be linked to the HE.
So how does an EEG work exactly?
Well, they place electrodes on the scalp, in this case the puppy's head. And these electrodes pick up the electrical signals from the brain. Those signals are amplified and displayed on a screen, showing us the brainwave patterns.
Okay, I'm following. So what did the EEG tell them about this puppy?
Initially, under anesthesia, for the CT scan, by the way, the brainwave patterns were normal. But as the anesthesia wore off, things changed.
What kind of changes are we talking about?
They began to see triphasic waves. These are distinctive brainwave patterns, often associated with severe HE in humans.
Triphasic waves, those don't sound good. Are they a serious problem?
They definitely are a sign of a disruption in brain activity. And to make things even trickier, triphasic waves can mimic another condition called non-convulsive status epilepticus, another type of seizure activity.
Oh, wow. So they had to determine severe HE or a different type of seizure activity. That's the crux of the matter, isn't it?
Absolutely. And it made treatment decisions difficult because the usual treatment for status epilepticus, benzodiazepines, can actually worsen HE in some cases.
So they had to be really careful. What did the EEG findings ultimately suggest?
Well, the EEG was crucial in guiding the treatment. It pointed them toward alternative medications, like levetiracetam, which might be safer in suspected HE cases.
So the EEG acted like a roadmap, helping them navigate this complex situation.
Precisely.
This case really shows how powerful EEG can be, not just for diagnosis, but for treatment decisions in veterinary neurology. Before we move on, though, let's talk more about these triphasic waves. The report describes their appearance on the EEG.
Yes, they were quite distinctive, high amplitude, over 70 microvolts, and 3 distinct phases. A small negative deflection, then a prominent positive deflection, and finally a prolonged, slow negative deflection. They were also widespread, across both sides of the brain.
So not only were they unusual, they were prominent and widespread, further supporting the suspicion of severe HE. This is also fascinating, but I'm curious, were there any limitations to this case study?
That's a good question.
I mean, it was informative.
Yeah, very. But the authors did mention a couple of limitations, one being that they didn't measure the puppy's ammonia levels.
Right, because we know that toxins bypassing the liver, including ammonia, can lead to HE.
Exactly. And ammonia is often a key factor in HE. Measuring it can help determine the severity and guide treatment.
So that missing piece of information is important. What was the other limitation?
They used a CT scan to see the structures, but they didn't use an MRI to examine the cerebellum.
Ah, we talked about cerebellate rigidity earlier. Would an MRI have been helpful in that regard?
It could have. An MRI gives a much more detailed look at the brain's soft tissues.
I see.
But even with these limitations, the clinical signs, the imaging, and the EEG findings all strongly suggestive severe HE. This case is still so valuable, giving us insights into the complexities of HE and the power of EEG in veterinary neurology.
Absolutely. This has been really eye-opening. Stay tuned because in part 2, we'll unpack even more details from this case, including the challenges of interpreting those triphasic waves and the potential treatment options for HE.
Looking forward to it.
Welcome back. We were talking about those triphasic waves on the puppy's EEG and how they looked a lot like another condition, non-conversive status epilepticus.
Right. And it really made things tricky with treatment because benzodiazepines, the usual go-to for status epilepticus, could actually make the H worse.
So how do benzodiazepines even work, and why are they problematic for HE?
Well, benzodiazepines enhance the effects of GABA, which is a neurotransmitter that inhibits brain activity, basically calming down those overexcited neurons that cause seizures. But in HE, the toxins can actually interfere with GABA's function. So giving benzodiazepines in that situation, it could backfire and make the HE even worse.
Oh, I see. So it's like a delicate balance. The report mentioned levetiracetam as a potentially safer alternative. How is it different?
Levetiracetam works in a different way. It doesn't directly target the GABA system. Instead, it modulates neurotransmitter release and inhibits the spread of seizure activity, basically bypassing the GABA system altogether, making it potentially safer for managing seizures. In patients with suspected HE...
So in this puppy's case, the EEG not only helped diagnose the HE, but it also guided them towards a safer treatment strategy.
Exactly. It really shows how valuable EEG can be, going beyond just diagnosis and helping make critical treatment decisions.
This case really highlights the complexity of veterinary neurology. One problem in one system, like the liver, can have these cascading effects on others, like the brain in this case.
Yeah, the body's all connected, you know. What affects one organ can impact others. And the brain, being the control center, it's really susceptible to these kinds of disruptions.
The report mentioned the triphasic waves. They were mainly seen in the frontal regions of the brain. Is that significant?
Oh, absolutely. The frontal lobes are responsible for all those higher-level cognitive functions, planning, decision-making, impulse control. So seeing those prominent triphasic waves there, it suggests those functions were significantly affected by the HE.
That makes sense. So on top of the physical symptoms, this puppy was probably experiencing some cognitive and behavioral changes too.
Most likely, yes. Although the report didn't go into specifics about behavioral observations.
Still, it paints a pretty clear picture of just how debilitating HE can be, affecting both physical and mental well-being. You mentioned earlier that triphasic waves, they're considered a hallmark of severe HE in humans. Is it the same in veterinary medicine?
That's a great question. And it's an area that needs more research, to be honest. Triphasic waves are definitely recognized as a potential indicator of HE in animals, but we don't have a clear-cut grading system like they do in humans.
So we can't say for sure what grade of HE the puppy had based on the triphasic waves, but they were still crucial in guiding the diagnosis and treatment.
Absolutely. They were a key piece of the puzzle.
We've covered so much ground here. The liver, the brain, toxins, seizures, EEGs, treatment approaches. It's amazing what we can learn from one case. But before we wrap up, I have one last question. The report mentioned the owners chose euthanasia. What factors led to that decision?
That's a tough one. And it's a sensitive topic, of course. I can only speculate based on what the report says. The puppy was so young and already experiencing such severe neurological problems, and those brain lesions on the CT scan, they were concerning too.
So the prognosis was probably pretty poor.
I think it's safe to say that, yes. While surgery to correct the portosystemic shunt was discussed, it's a very complex procedure with its own set of risks. And even with surgery, there's no guarantee the puppy would fully recover from the neurological damage.
It's heartbreaking. Ultimately, the decision to euthanize, it's a deeply personal one, made by the owners in consultation with the vet team.
Absolutely. And it really highlights the emotional weight of these cases for both the animals and their families. And it reminds us how important compassion and empathy are in veterinary medicine.
Well said. We've covered a lot of ground in this deep dive. Stay tuned for part 3, where we'll explore some of the broader implications of this case and what it tells us about the future of veterinary neurology. Welcome back to our deep dive into veterinary neurology. In the last 2 parts, we talked about this fascinating case of a puppy diagnosed with HE, hepatic encephalopathy. Now let's zoom out a bit and talk about what this case means for the field as a whole.
This case really highlights how important advanced diagnostic tools are becoming, like EEG in veterinary medicine.
We talked about how the EEG was used in this case to help diagnose the puppy and to guide treatment decisions. But how common is EEG in everyday vet practice?
Well, historically, EEGs were mostly used to diagnose epilepsy in animals. But like we saw in this case, we're starting to see how useful they can be for assessing all kinds of neurological disorders.
That's like having this window into the brain's activity, giving vets this real-time information so they can make better decisions about patient care.
Exactly. EEG provides this objective data that complements clinical observations and other diagnostic tests, adding another layer of understanding to these complex neurological cases.
And this case also really highlighted the connection between different organ systems.
Absolutely. What affects one system can have a ripple effect on others. The liver-brain connection here was a perfect example of that.
It really underscores the need for a holistic approach in veterinary medicine, considering the whole animal, not just the symptoms.
Right. You need a deep understanding of anatomy, physiology, and pathology to be able to diagnose and treat these complex cases.
This case, with the sad outcome for the puppy, it makes you wonder about the future of veterinary neurology.
I understand what you mean. But even though there are always challenges, there's also a lot of hope. This case shows how far we've come. In veterinary neurology, we have advanced imaging techniques, sophisticated tools like EEG, and a growing understanding of these complex neurological conditions.
And we have dedicated vets and researchers who are passionate about pushing the boundaries and improving animals' lives. Speaking of pushing boundaries, are there any emerging technologies or research areas in vet neurology that you're particularly excited about?
Oh, there's so much to be excited about. The development of new treatments for neurological disorders is particularly promising. We're seeing progress in gene therapy, stem cell therapy, even the development of neuroprotective drugs.
Wow, that's incredible. So there's real potential for breakthroughs that could really change the lives of animals suffering from these conditions.
Absolutely. And on the diagnostic side, advances in imaging technology, like more portable and affordable MRI machines, could make these tools more accessible to more veterinary practices.
That would be amazing. It's such an exciting time to be following veterinary neurology. Who knows what incredible discoveries are on the horizon?
That's the beauty of science. It's an ongoing journey of exploration and discovery. And in vet neurology, every discovery brings us closer to understanding, treating, and preventing neurological disorders in animals.
This deep dive has been a truly incredible learning experience. Thank you so much for guiding us through the intricacies of HE and for shedding light on the future of vet neurology.
It's been my pleasure. I always enjoy talking about these fascinating cases.
And to all our listeners, thank you for joining us on this journey into the amazing world of veterinary neurology.
Remember, knowledge is power, and the more we understand about the brain, the better we can care for our animal companions.
From Vet Neuro Jar, keep those minds inspired, hearts light, and tails wagging.